Good morning.
Good morning.
Hello, hello. Well, just when you think you know how things are going to roll, you get surprises. And so when I envisioned this meeting today, I envisioned me sitting in my office at my computer screens and all of my digital stuff at my fingertips. But surprise, surprise, I am a new Grammy and a first time Grammy. And so I find
Oh,
myself in Tennessee right now. So
congratulations.
I am I am joining in via Tennessee to for our meeting today with a smile that I can't hold back. Like it is just amazing.
Well, you have to
So,
give us all the details, of course.
well, of course. Course. His name is Lucas James Bigley,
Oh, I have
and
a Lucas James in my family.
you do?
I do. He's
Oh,
9 now, but yeah.
okay. Well, Mr. Lucas was born, I have to look on my phone. He was born April 17th, so it's almost 2 weeks old. So I got called into Grammy duty and I was like, I'll come whenever you need me. And so I got the phone call and I said, absolutely, I'll be there. And did a little planes, trains, and automobiles to get myself where I needed to be. And it was perfect. I've loved every minute. So, um, anyway, so I am upstairs where we made it to their house. And so I am upstairs at their house, and the baby and mama are downstairs right now. So I'm hoping that I'm going to have great Wi-Fi connection the entire time. But if anything happens and I get cut out, y'all just carry on, okay? And I'll log in via my phone and be right back. But otherwise, but Mr. Lucas is doing fabulous. He weighed 7 pounds, 7 ounces, 20 and a half inches long, and he
Okay.
has hair. He has hair, dark hair. It's amazing. I love it so much. So he is a cutie. Everyone tells me how great it is to be a Grammy, and I was like, okay, I can't wait. And so now I'm believing every minute of it. So,
Oh my gosh. I love
all
it.
right.
I love it, love it.
So fun, so fun. So Sarah, all of my MCH coming into play. I'm like, all right. So some new parent questions come through, and I'm like, I do know that. I
Yeah.
do know that. So it's super good. So I love it. So we are rocking it here. Well, it looks like it is officially 10:01, and it looks like we have we've got some people who've joined us. So that is fabulous. I don't see Martha, but we will go ahead and get started. Looks like I apologize if I say this wrong, but it looks like Dr. Bautiste is with us.
Yeah, thank you.
So yeah, welcome. And so we know he's here. So if nothing else, we can start our agenda and then we might skip around a little bit and go ahead and let Dr. Batiste speak. But let me get things started. Let's see. I know I pulled up a copy of the agenda, so I would have it to speak from. But of course, as it would be. I don't see it now that I'm looking for it. Let me open.
Louise, I wonder if I can drop it in the chat.
That would be helpful.
Let me see. Okay, let me try real quick.
All right, thank you. That would be helpful.
Come over.
When I did leave town, I was expecting to I anticipated on grabbing my folder, and yeah, it's still sitting on my desk. So thank you.
Okay.
Is it in there, Sarah?
No, I'm just going to email it to you.
Okay.
Are you able to get to your email?
Yep, I sure can.
Okay. Try that. You'll have to open the attachment.
Okay. Oh, well, I
Louise,
literally
you
had
have
it
some
open.
tornadoes in your neck of the woods.
Hmm. Let's try it again. My apologies. Oh, there. There it is. All right.
Did it come through?
Yes, it did.
Okay.
Thank you for that.
Okay. You're welcome.
Okay. All right. So it is officially 10:03. My apologies for a late start. I don't necessarily like to do a late start, but um, I had to share my exciting news. So thank you for being so welcoming for me to share that. But today we're here for our MPH section for Public Health Nurses meeting. And so we'll officially call this meeting to order. We have it scheduled from 10 to 12. It may not take that long. If we have the opportunity to give you some time back for your day, I'll be happy to do that. So we'll just work through the agenda and please feel free to ask any questions, add any points to any discussions as we go through. This is our meeting together. This isn't a meeting that's being told to you, but it's a meeting that's being held together. So we're definitely thankful for everyone to be here. My name is Louise Bigley. I am a nurse at the Webster County Health Unit in Southwest Missouri. I serve as the lead health education coordinator, and I have a team there, and we're just super excited about the work that we can do in our community. Today, what we'll do is we'll just kind of go through everyone that's logged in so that you can say your name and where you're from. You don't necessarily, we're not giving like updates right now, but just the idea of like who's at the table for our conversation today, so everyone can know who's talking, and also gives them an opportunity to make connections a little bit later. So through our agenda, we'll just do kind of some business updates. We've got Dr. Bostis with us as a guest speaker. We'll go through some old business and just talk about some of the great things that our past president, our chairperson, Kayla, really got rolling for us. And then the teamwork that took to get all those things done. So that's pretty amazing. And then at the very end, we'll give member updates. That's just an opportunity for you to like share something that you're just super excited or happy about, that's been going on in your world of public health nursing. Or maybe it's not going so good and you're like, has anyone else ever had this issue? That this is a great time to ask that too. So we'll do that at the end. So let me get back over here to my screen where I can see everyone's faces. And I'm just going to go according to how they show up on my screen. So not necessarily how they how you logged in or anything like that. So Sarah, you were the last one to speak. You were up on the big screen. So Sarah, I'm going to let you introduce yourself, and then we'll just kind of go through that.
Okay. I'm Sarah Gorman. I work for the Missouri Department of Health and Senior Services, and I manage what we call our maternal child health services program. And so just a real brief overview, we work with all of our local public health departments. There are 115 in Missouri, and we contract or work with 112 of them to improve maternal child health outcomes at the local level.
Great. Thank you for that. Thanks, Sarah. Thanks for being here. All right, Trina, you're up next.
Hi, I am Trina Teacutter, and I am the Community Health Manager at Columbia-Boone County Public Health and Human Services, and that just means I oversee all of our clinical services, nurse practitioners, nurses, and communicable disease, and I am the current secretary for our section for public health nursing.
Thank you, Trina. Appreciate you. All right, Pam Dudley, you are up next.
Good morning. Made it through the tornadoes that were passing through. Um, I work for Michigan
Everything's,
State University.
I'll say
And,
everything's still intact in Southwest.
the storm damage is coming into the news media and power
Okay.
outages, but
All right,
storm
well, good.
winds and rain so far. Anyway, yes, went into emergency mode here at the house. Uh, I work at MSU in the Ozarks Public Health Institute.
Thank you. And Pam has just been so helpful to us and a longtime public health nurse who has just really advocated for all the work that we do. So
Well,
thank you, Pam, for being here today.
Thank you.
All right, Sandra, I know you always work behind the scenes, but I think you should introduce yourself as well.
All righty. Sandra Beckman, I'm the Executive Director for the Missouri Public Health Association, and get to work with you guys in the section. And that's probably all you need to know from me. I'm always behind the scenes. So if you need something, just put a message in the chat.
All right, thank you, Sandra, for being here. We really appreciate it. All right, looks like Tara's up next.
Hi, I'm Terry Fitzgerald, and I am with Cooper County Public Health Center. And my title is nurse manager, but I manage one nurse. There's only two of us here. So I do all things nursing here, all the stuff from investigations, to immunizations, to tuberculosis testing, active TB guys, they get meds from me. I do all of that. I do multiple things. And I'm also the MCH contract person on the CCHC contract. I'm assisting with MRC. We're small rural county. So we kind of all get to wear the multiple hats and share them.
Absolutely. And you know, the reason why they put nurse manager on your title is because they couldn't put all those other words on there.
Yes.
Like you wear so many hats, so many things going on. So
Other duties as assigned.
that's it. It wouldn't fit on the line. So
Yeah.
that's it. Thank you for being here today. Really appreciate you. All right. Looks like Kelly's up next.
Hi, my name is Kelly Vaugh, and I work for Missouri Department of Health and Senior Services. I am the school nurse specialist. So I work with all the school nurses across the state. We have 558 public schools and then a lot more private schools. So just do education for school nurses, leadership, all that, anything that they need.
Well, thank you for working with our school nurses. They are definitely overlooked often, and the great work that they do keeping our kids healthy and safe in the school systems. And I can easily get on a soapbox about that, but I won't today because I love my school nurses so much. But thank you, Kelly, for being with us and helping our school nurses and keeping them informed of the things that are going on. So we appreciate that. All right, so let's see. After Kelly, it looks like I see Macy.
Hi everyone, I'm Macy Shin. I am also with Department of Health and Senior Services, the Maternal Child Health Services Program. And hopefully I didn't freeze. You guys froze for a second, but I work with Sarah Gorman.
What part of the state are you in, Macy?
So I cover the West Central District. So
Okay.
I go start here in the middle and go all the way to the Kansas City area.
All right. So definitely a great resource for anyone in that area. And actually, I've never found a time where I couldn't reach out to one of our MCH nurses to get any kind of information. So thank you again for being here, Macy.
Yeah, absolutely.
All right. It looks like Amber Lee is up next.
Good morning. I'm Amber Lee. I'm a school nurse at Carl Junction in Southwest. And I'm the representative for the Missouri Association of School Nurse group. And so I take back the information we learn here to our constituents, our other people in our group.
Oh, I love that so much. Thank you so much, Amber Lee, for being here.
You're
Appreciate
welcome.
it. I think
Here at
school.
Carl Junction, I'm the lead nurse here, so I do all of our health service programs at the school
All
district.
right. Yeah, school nursing can be very isolating if you are in a small area and maybe you're one nurse for all your school building. So yeah, definitely great that you're being a resource for them and taking back information. All right, well, I don't know who Samsung SM-FN46U is, but I'm excited to find out.
Hi, I'm Patty Russell.
Okay, Betty.
That's funny that came up like that. But anyway,
That's
I work PRN for the Warren County Health Department, and my big thing right now is I am providing free CPR classes to the
great.
communities. So that's my big thing. And we have a mobile van that we go out and do blood pressures and education. So those are my two big
Wonderful.
things.
Wonderful, wonderful. Thanks so much for being here. All right, and A. Hicks is up next.
Hi, my name is Angela, and I work at the Warren County Health Department. I'm the immunization nurse. I also do STI testing as well as lead investigation.
Wonderful. Thank you so much for being here. Let's see. And it looks like Martha Smith. Yay, Martha.
Good morning. I'm Martha Smith, and I'm the State Director for Maternal and Child Health, and I also serve as the State Lead for Public Health Nursing.
Wonderful. Thank you so much for being here, Martha. And I know you've got some great things to share with us here in a little bit. Is there anyone other than Dr. Bottis that I have not, we're going to save him till he actually speaks. Is there anyone else that we have not done an introduction, has not done an introduction? If so, please come off and give us an intro. I am not seeing anybody. There. Oh,
one more. Hi.
Yay, okay.
Hi, my name's Stephanie Wool. I am the administrator over communicable disease prevention at the Green County Health Department.
All right, thank you. I'm so sorry I missed you.
Oh, no.
My screen is updating as people come into the list. So, all right, well, great. Well, if anyone else joins us, we'll encourage them to introduce themselves as well. We won't call them out and make them feel awkward, but we definitely want them to share with us. All right, I'm going to toggle back over to my agenda. Yeah, I'm not as good with the toggling on my computer as I am doing it from my home desk, but all right, so we've done our introductions. So the next thing would just be our approval of the January 23rd meeting minutes. Those were sent out by Sandra. Does anyone have any questions or comments of anything any corrections that need to be made? I am not seeing any movement on the screen about any corrections or anything to that. So my next question is there anyone willing to make an motion for an approval of the minutes?
This is Amber Lee. I motion to approve the minutes.
Thank you, Amber Lee. Do I have a second?
I second. This is Pam.
Pam, thank you. Is there all in favor? I gotta hang on a second. All of a sudden I've got a full screen and I can't get back to my other. All right. Is there, if you want to I'll scroll through the pictures. All in favor of accepting the minutes? I see a couple of hands go up, hand up, thumbs up. All right. Well, it's kind of hard to juggle between photos and not photos. And so I'm looking at that and I'm seeing that's a majority. So we're going to accept those minutes as they are and call that accepted. All right. So Sandy, you're up next. We've asked Sandy, just because we've to give like a little financial update. We have a little bit of money that comes in and goes out, and so keeping everyone aware of what's happening, if we feel like just continues transparency. So Sandy, you want to go ahead and give us an update?
Sure. I might even turn my video on here.
All right, look at that.
Oh, gosh. Okay, so I thought I'd sent this little blurb to you, but in any case, the section received from the Department of Health in 2022 $5,000. That was for initial membership to get the section going. In 23, we have received another 5,000, and then 24 and 25, we got $10,000 each. That 10,000 was sent to OPHI for the work that they did on the manual and the website. So that's where we are financially. If anybody has any questions, Martha can probably answer them.
I appreciate that. So the good thing is the money that has come in has also went back out for our work. So we're very happy about that. Thank you for sharing that, Sandy. Does anyone have any questions for Sandy? If you do, please just come off mute and ask her anything. All right. I don't see anyone coming off mute, so that's good. We're going to move over then to the next part, which is our MPHA update, which would be for me. I did attend our last MPHA state meeting. There was really three primary discussion topics. Just the legislative, helping everyone to understand everyone's roles and things that were going on in this legislation process. The second part was marketing. A lot of our public health nurses come through like their LPHA if they're with a local public health agency, but then maybe there are others that don't know about the section. And so how can we market it out there to get more awareness of the section and bring nurses together? They also voted to have a decrease in the membership cost for students for MPHA. So hoping that especially if they're coming through a public health program, that this would get them actively involved as a student, and then they would continue that role when they go into their professional role. So that decrease in the cost for them. And then there was some revision discussion about the MPHA scholarship process. So that was really the primary three things that I had on my list of activity. So all right, so then doesn't seem like there would be just a whole lot of questions about that, but oh, I do see that Martha said that the funding for 2023 was 10,000, right? And then 10,000 for 24, which we just received not long ago. So yes. All right. Okay, well then that takes us up to Martha for our DHSS update, APHN update. And Martha, if you have anything else about the MPHA meeting, you're welcome to share that. But Martha, I'm going to let you go ahead and give us your update next.
Thanks, Louise.
Yeah.
I might just add with regards to funding. So there are 2 more years of funding currently budgeted through the Public Health Infrastructure Grant from the CDC. So those will be for 2026 and 2027. There is the opportunity for the section, and the executive committee is having conversation around requesting some additional funding for, just supporting enhanced capability through the section, as well as for the public health nursing community of practice. And so, if you have specific ideas about that or things that you think would be beneficial to enhance public health nursing, workforce development, and an ongoing professional development, let one of the executive committee members know, please, as we look at those things. So with regards to the Department of Health and Senior Services, every day is definitely a new day right now. And we just never know what might come down the pike on any given day. So over the last month, especially, there have been some significant developments that I'm sure none of you are unaware of. But as things have moved and transitioned at the federal level, of course, that has impacted state funding and state programming. So we found out within the last month, of course, that the ELC grant was being ended early. So it was already slated to end in about another year, but that was ended early. And so all of that funding had to come to a screeching halt rather than having another year to phase that out. And that really impacted a lot of department programs and positions, as well as all of the local public health departments and that local public health system. We also received a press release and a fact sheet from HHS that detailed changes happening within HHS. If you haven't seen that, I'll after I'm done talking here, drop some links in the chat. But essentially, HRSA and SAMHSA, along with some other organizational units within HHS, are planned to be done away with, and some of them will be rolled into a new AHA. So it'll be, oh goodness, I just went blank on the A, but it's it's basically along the lines of the Make America Healthy Again organizational unit, and that will include programming really aimed at chronic disease prevention, and it will include maternal and child health and a specific division for maternal and child health. That has not been passed yet, so it is still planned and conceptual at this point, but that is the direction that they seem to be moving. And the new focus for HHS has been messaged to be chronic disease prevention and reduction. We also last week, or maybe it was actually over a week ago, a little over a week ago, a document from the Office of Management and Budget was leaked inadvertently. It was not intended for public dissemination, but it includes a new organizational chart for HHS, as well as proposed budget for HHS, and it lists specific programs that are not proposed to be funded. So there are some significant program areas that are not included in that budget that are listed for budgetary exclusion and bringing to an end those programs. So I will also share a link to that, but please keep in mind that is not official. Nothing in it is a done deal, and it was leaked inadvertently and not intended originally for public dissemination. So I would ask all of you to please be cautious in sharing that with anybody else, especially outside of your local public health administration. As all those things are happening, then it impacts how we plan at the department. Title V was included for continued funding. However, the House has proposed one budget, the Senate has proposed another budget. Some, one includes a cut, one does not include a cut. So time will only tell where that comes out in the budget process, since the president has still not proposed his budget for House and Senate to respond to. At this point at the state level, we are still waiting to see what happens in budget reconciliation, to know what programs that have requested new funding will receive that funding and at what level, as well as any potential changes that could happen to our department budget through the final budget processes here at the state level. At this time, we are not aware from an MCH. I know y'all are not just MCH, but I always say that's where it begins and ends. But we are not aware of any proposed cuts right now, as of this moment, to maternal mortality prevention or to fetal and infant mortality review. However, that can always change. And at the national level, one of the programs at the CDC that was excluded from the cuts and reorgs and different things was maternal mortality review. So at this point, maternal mortality review remains in the federal budget as well. We also at the department, as you all know, have a new department director, and under the direction of our governor, who made it clear in his State of the State address back in January that his intent was for the state workforce to primarily return to work in the office. Then state agencies were charged, state leadership of those agencies was charged with evaluating their workforce and putting forth plans for a return to work in the office. And so Director Wilson has been working with department senior leadership to evaluate the department's practices and current policies, and then to put forth a proposal to the governor's office. And then that new policy was rolled out to the department workforce last week. Actually, my weeks run together. It could have been the week before. Yeah, it was the week before. But that was rolled out to us along with a new dress code policy. So those both go into effect June 1st. The dress code policy, you may have gotten used to hearing about or even seeing, although we weren't supposed to be wearing casual clothes when we met with others outside the department. But, our dress code the last few years has been a little bit more casual, and we are going back to a business professional attire based dress code policy. And then our work location policy will go from having about 4 different types of approved work locations and scenarios to having 2. So the majority of the workforce will be returning to work in an office setting full-time. And then there will be some who will be approved for telecommuting based on certain criteria, such as if they live more than 60 miles from their official domicile, if they spend 50% or more of their time out in the field, or if they have a role that requires highly specialized expertise, that it would be hard to fill that position if that person left because, returning to work in the office was not conducive for them. So those are the main criteria, but that decision is being made at division level, and it's not a given that just because somebody meets one of those criteria, they will automatically get approved to work from home. Right now, the department does not have the space to accommodate everyone returning to work in the office because through the pandemic and through the transition to a distributed workforce, we let some leases in on some buildings and office space. So they're working all those things out. So it's going to be a transition. There may be some people who have to share offices. There may be some people who return to work part-time at first and then transition into full-time as the office space scenario is figured out. But these 2 policies go into effect June 1. I am very hopeful. Senior leadership is also very hopeful that we don't see a mass exodus as a result of this return to work in the office policy. Many state agencies have already mandated a return to work, and many state agencies have mandated a full return to work in the office, where there were not any flexibilities or alternatives offered. So we're hopeful that this does not create undue barriers for people to continue working, because the department really has, through the distributed workforce flexibilities over the past few years, we have been able to hire a broader diversity of team members that bring, that broader diversity of skill sets as well, and expertise. And so really hopeful that the process lends itself to meeting people's needs, but time will only tell on that. From a national public health nursing perspective, the Association for Public Health Nurses has their annual conference coming up, and that is all virtual this year, and starts on May 7th. It's not consecutive days, it's blocks of time on certain days in May. If you haven't looked at that, I encourage you to look at that and consider if the agenda would be worthwhile for you to take advantage of, especially since it is virtual. It makes it much easier to participate. Some of the sessions will be live virtually, and then others are recorded. So I encourage everybody to take a look at that. I will be participating as my schedule allows. But if you have a specific session that you're just really interested in hearing about, if that's a session I attend, let me know if there's something that you're like, oh, I really want to hear about that. And I'm more than happy to share any materials or resources that I gain from attending and participating in it. You should have also received a forwarded email about the public health nursing job task analysis questionnaire that APHN put out. And a while back, there was some communication about interest in a public health nursing certification coming back into existence. And this questionnaire is peripherally related to that. I think they forecasted like it might take you 10 to 15 minutes. I don't remember off the top of my head, and I'm not seeing it right away, but they're wanting to get 5,000 responses across the country. And, so this is a time for Missouri to be the show me state. So let's show them that we can bring the numbers, and the numbers represent input to me. So it's not just about numbers. It represents input. So this is an opportunity to let our voices be heard, and to really contribute a repository of information and knowledge about the role of public health nurses across our state. And then that contributes to that understanding across the nation. So I encourage everybody, I'll drop all these links in the chat when I'm done. I'll continue to share the public health nursing, the APHN e-newsletter that comes out. So they are gathering the information for that next newsletter right now. And I'll continue to share that out for everyone's awareness. And feel free to reach out with any questions that you may have about APHN or public health nursing. How does APHN work with APHA and the section for public health nursing at APHA? Because they are different and distinct. And I even asked for a little bit more background as to why we have these two entities, et cetera. So if anybody has any questions, I'm more than happy to answer them, or to seek answers if I don't know the answer, to seek that information to be able to respond. Thanks, Louise.
Thank you, Martha. Really appreciate that. And just, from the local level, just understanding what the impact is for you all at DHSS helps us to just feel more I don't know, maybe less left out, like we can understand what you all are going through and the changes so that it helps us to make more sense of it. So thank you for that. And I suspect that the leak of the document was not actually an accident from the person who leaked it, but we understand that it's not a official document to be, that you're sharing. It's just something that was put out there. So I have actually read through it. I've seen it, and I thought it was very in. I don't know if insightful is the right word, but I definitely did start to understand a little bit more of like when I hear things, what the thought process is and how things are moving. So anyway, thank you so much for sharing all of that. And if anyone has any questions for Martha, please feel free to drop a message in the chat, and I'll let her kind of glean through that and see if there's anything she can respond to. I know she said she's going to drop some items in there. So, oh, and there's the press release. So perfect. Which I have not read, so I'm anxious to read that as well. Okay, I think we're going to move on to our new business. And I asked Trina if she would care to introduce our guest speaker. We only have one guest speaker today. So Trina, do you want to come off mute? And
Sure.
Thank you so much.
Well, I connected with Dr. Bautista through Linnell Phillips. And he and I and Linnell and Kalechi, I think, had a quick meeting about a project that he is working on. And so that's kind of how this came about. I thought it was something that would be good to be brought to our section. And I think, are you talking with the school nurses too, or have connected with the school nurses? So he's getting that information out there and getting support for his project. So I'll let him introduce himself and tell us all about what he's working on.
Yeah. Thank you so much, Trina. Can everyone hear me? Yeah. I hope you're staying warm and dry. I think here in Colombia, there are some thunderstorms right now. So my name is John Robert Bautista. You can just call me Robert. I'm an assistant professor at the St. Clair School of Nursing. I'm relatively new. I just started January in 2024. I mainly teach in the nursing in communities class, and we're very fortunate to have Trina. To be part of our class, sharing her insights on her work in public health. On the flip side of the coin, I also do research at the intersection of public health, nurses, and technology. And one of the hottest technologies that we have right now is artificial intelligence. That would be the main topic that I would be presenting to the rest uh, uh, of the audience today. So if I may, I'll just share my screen right now. I think I did send a request.
Sandy might need to make it so that you can share your screen.
Should be able to now.
Okay, thank you. So, yep. Okay, so let me just check that again. So can you see my screen right now? Yep. So
yes.
Thank you so much for giving me time to present some of the research programs that I do hope that I would be able to collaborate with the Missouri Public Health Association's section for public health nursing. So I'll just give everyone a brief overview of my research program on generative artificial intelligence and public health that mainly involves public health workers and more specifically our public health nurses. So I'm presenting this on behalf of my research team. So I have Dr. Luisi, who's an assistant professor in the School of Journalism. She does research on health communication and does like qualitative research. I'm also working with Dr. Tong, who is a health communication scholar and a computational social science scholar. So some of you might be wondering what does a computational social science person does. So in this project, we also conduct interviews with people, and analyzing interviews is really time consuming. So we actually use natural language processing to actually give us insights in much shorter period of time. That's one way, because the project would involve like focus groups, interviews. There are lots of like interview transcripts to discuss, and we hope that we could actually get faster insights by using computational methods. Next is we're also partnering with Kalichi Onyaka, who is currently a PhD student at MU and also the director for programs and research at the Missouri Immunization Coalition. So in terms of my background, I have like interest really on public health because I have a master's in public health. And I also did like health informatics and health communication research for like over a decade from now. So again, I'd like to thank everyone for providing me the platform to share insights about our project. So I think this is something that I've heard in the early portions of our meeting today. Um, we are perpetually always in a reduced public health workforce. I think that's always have been the case for many, many, many decades, and this is something that's happening right now. And there are some factors that can exacerbate um, the decline in public health workforce. But essentially, based on these two studies, publications, the reduction in public health workforce puts a strain on the ones that are left behind, like those that are actually working right now, like us, wherein the job demands can increase because there are less people to actually help with the task. And at least from the workplace perception, and they have this public health workforce interest and need survey. Um, the resulting reduction in public health workforce actually translate to an increased intention to leave the public health workforce. So these are some of the realities that we have to contend right now. Now we have a technology like artificial intelligence, and for the general public, like AI is like AI, but we have different layers of AI. I won't discuss them here in depth, but we now have like technologies like Chat GPT that if you ask that, can you give me a recipe for a spaghetti? Then it would produce a text and output. To some extent, if you ask it to give me a picture of a person teaching or having meeting, then it would generate like an image. And that technology is what we specifically call generative AI, wherein it could generate text, images, sound, audio, video as of the moment, and the technology keeps on improving. Now, maybe I'm not quite sure, but some of you might be using ChatGPT, whether it's for personal use or like for health, for work-related use, and maybe some of us are one of the 400 million weekly users who's using ChatGPT. But this has different applications from like business, from the healthcare sector, but in the reception is not always positive. So, for instance, nurses in California actually had like a strike wherein they feel that AI is undermining patient safety, and this has been the case when nurses are somewhat left out in the table in terms of decision making and developing. One good example is the development of the electronic health record. There has been limited input with the development of electronic health records, despite nurses being the primary users of electronic health records in terms of clinical documentation. We want to avoid that. But for nurses to actually participate in decision making about how to chart AI, we actually need to make nurses aware of this technology, to train them how to use existing technologies. And unfortunately, most of that training, most of those awareness is on the clinical side of nursing. But what about the public health side? So public health is really important because it is where we could make an impact because it focuses on health promotion and disease prevention. And I believe that we can use these technologies to help us with our mission of providing on promoting health and preventing disease, especially chronic disease. So more recently, like just this Thursday, so some of my colleagues at MU from the Institute of Data Science, I'm working with Dr. Shiren Xu in terms of some research projects, and he attended the 25 State of Missouri AI in Government Symposium. I think what's missing there is like the health office. We want to have like the Department of Health and Senior Services there also, but this at the state level, there's interest on how we can use AI technology to improve business practice, to improve service delivery, and public health is one of those that we could actually use AI to improve some of the public health processes that we're doing. And how can it transform public health practice? So in this article, June 2024, time flies so fast. We're now 2025. We just heard ChatGPT by end of November 2022. It's been a couple of years since it existed. People are not aware of what AI is, what ChatGPT is. But in this article, the authors point out that it could transform public health practice. So generative artificial intelligence can transform public health practice in three application areas. So for instance, public health communication, um, translating text is not an easy thing to do. Making our health messages much more understandable for the general public is a huge task. And there are technologies like generative artificial intelligence that could actually help us somewhat make our health communication messages much more understandable to promote health equity. Next is organizational performance. To give you um, one insight, like for example, in this meeting, there are some organizations that allow AI transcription, wherein after the meeting, once it's recorded, there will also be AI transcription that summarizes what happened. Maybe that could help with organizational performance by reducing time about transcribing meeting notes and people to have better situational awareness of what's happening during meetings. So that's one example. Next is novel insights. What if we have like piles of documents, like public health documents or any case reports at the like social services or any kind of public health data? We can actually summarize them within a short period of time if we could effectively use generative artificial intelligence. So those are some three application areas, but it's not always the benefits. My research is really always looking at the challenges, the risk of using them, because I believe that these technologies should be used in conjunction with what we need and want that technology to function. For instance, do our constituents trust us using this technology? I think that's one key issue here is that, well, this technology is useful, but do people, would it tarnish the reputation of public health agencies when they mostly rely on AI? So that's one key concern. Next is health equity and ethics. Maybe some health public health agencies that have huge funding mechanisms would provide those services to their community. There will be those that are left behind, especially in rural areas. We want to close the gap by training public health workers, whether they're in urban or rural setting. And that also coincides with like ethics in terms of doing good and preventing harm. Finally, is workforce implementation. This has always been the problem for any technology. Well, the technology is good, but it's not financially sustainable to do it. Where can we start in terms of with work for capacity building so that public health workers, regardless of their public health setting, would be able to use this technology to take advantage of it and be able to improve their service delivery. So those are some of the challenges. Now, I also like to point out that this has always been the case for technologies, for health information technologies, wherein sometimes we develop these technologies without much consultation with people. And that is really unfortunate. That's why, as part of my project, it's really involves like consultation with community members, whether they're the service providers or the service recipients. But at the end of the day, it needs we need to prioritize that these technologies, like AI technology, align with stakeholder values. And sometimes one stakeholder has a conflict with another stakeholder. That's why dialogue is important. So part of my project is also talking with people. And this is really a good opportunity for me to talk with you because you're the service provider and you're also the beneficiary of any capacity building workshop that I aim to conduct in the future about using generative AI. So first, I'd like to give you an overview of like what my research is all about. So my research is mostly about looking at technology not only as a piece of object or device, but as an object that has implications with how people work, how people live, and how policies are set forth. So we have technical systems. So we have the technologies like ChatGPT, Microsoft Copilot, Google Gemini. If you do a Google search right now, the newest thing that you can see is that on top of it, there is always a summary now that is provided by Google Gemini. People, you might not really notice that much, but it's there and it's here to stay. And with those technologies, you can actually, for example, for ChatGPT, you can do a Q&A with it. You can follow its instructions. If it provides some instructions, you upload a PDF to ChatGPT. It can give you ask it, give me a 500-word summary. It can give you the summary. So it can do information extraction. At the Department of Health and Human Services, they do have use cases inventory for artificial intelligence. But if you look at it, mostly there's limited use cases in the public health. They're mostly reflected clinical. So we need to somewhat get to know more about the public health side of things. Also, in terms of structure, when I say structure, it involves like organizations that might influence like policies, guidelines on how it's used. So definitely the state of Missouri is ramping up on its AI initiatives. And it has implications with how the Department of Health and Senior Services operate. And we also would like to get to know like what do local public health agencies, what do public health nurses think about AI technology. And I think partnering with the Missouri Public Health Association and the section for public health nursing is really important for this project. So we want you not only to like just like assisting in data collection. No, you're also part of the research wherein I might interview some of the leadership team to get to know their insights about like what's the implication of public health with AI and the rest of some insights. And we're doing this because first we want our public health nurses to be up to date in terms of technology, to be able to facilitate better healthcare service, public health service to our constituents, be it in an urban setting or a rural setting. So we want to close the divide in terms of urban and by providing capacity building workshops, getting to know how can this help with their work. So if you combine all of those insights from the technical and social point of view, like how do public health nurses perceive this technology? Do they think of it as something of a on a positive light, or this is something of in a negative light? Those are things that we have to contend. And are they using it right now? If so, how are they using it? Are they using it formally or informally? Which means that formally it is sanctioned by the state government. Informally is that they're using it because it's convenient to use, and there's no guidelines that says you can't use that. But well, they're using it, so it's interesting to know to what extent those things are being used. Next is implications. If public health nurses use this, what would the people think about it? Is this something that people would trust? Next, do we need to update guidelines? Do we need to update policies about its use? So there are some implications that it's really interesting to actually know, and the details for those things are very limited right now. So it's not only the state of Missouri who's grappling with this kind of issues, but like literally all different like public health agencies across the world are having this kind of like issue. So these are some of my research aims. Like for aim one, I just like examine Missouri public health workers' views on Gen AI, generative artificial intelligence. Like how do they use the like identify use cases? Like for instance, are they using it actively for instance, summarizing patient education materials? Are they using it to improve organizational performance by recording meetings like this and using AI to summarize meetings? So I'd like to hear more about those things and identify factors like is there organizational support for this? Is there organizational um, like funding for this? Is there peer pressure among colleagues that oh since one person is using that maybe it's something that might be useful for me? So I'd like to identify some of those factors and in general, be able to develop, implement, and evaluate a capacity building workshop. I'm not quite sure if you've attended some workshops for generative AI tools, but I would definitely tell you that they are not public health focused. So if you attended one, most likely it's like general, it's like how to use Gen AI, some of the ethics, some of the key responsibilities, but they're not necessarily tailor fit for public health workers. So part of the project also is to identify training needs and develop materials, implement the workshop, and evaluate whether to what extent did we reach our local, like our public health nurses? Did we reach sufficient numbers? And is this effective? Is the capacity building effective in terms of increasing awareness and knowledge about generative artificial intelligence in public health? So some of the preliminary activities that we had are like I did interviews with nurses like across the boards, like nursing students, nursing faculty, and practicing nurses. And I did 32 interviews. Of those 32 interviews, I interviewed 11 practicing nurses. And of those 11 nurses, I had 3 public health nurses. So I tried to sprinkle a lot. And just from the small insight from those 3 public health nurses, they mentioned that it is here to stay. Like this technology is here to stay. I mean, it is inevitable. The Missouri state government is conducting like seminars on this. I mean, it's here to stay. But the problem is that the adoption will be more on the clinical side of things rather than the public health. And we need to close the gap on that. And the insights is that we need more insights on how generative AI is being used and what's its implications in public health, at least from the state of Missouri. We also did like a review of literature on how health consumers think about health information from like, let's say, ChatGPT. And like we just found like very few studies, like 15, and more people are actually using them to search for health information. Like you can actually, there has been a case wherein a mother put all his child's laboratory results in ChatGPT to identify the diagnosis of his son, and somewhat ChatGPT was able to provide a couple of like a specific diagnosis, and that mother double check it with with the child's physician, and actually was right because it was laboratory confirmed. So people are now using them. So as public health workers, how do we deal with that when like if our constituents are actually using them? We should be familiar on how these things how are these things working. And but for most of the synthesis of the research is that these technologies are useful, but it's not trustworthy. So people would still rely on their trustworthy source of information, which are nurses and other healthcare professionals. So what it only means is that we need to have workforce training on generative artificial intelligence. And we also recently conducted like responsible AI in health research workshop. Like this was just last Friday. And we actually have the capacity to conduct this as part of the capacity building for public health nurses, like responsible AIs, like how to use AI technologies in a responsible manner. So here at MU, we have the capacity to provide this kind of workshops. This is not new to us. This is something that we can extend to public health workers. And in terms of contributions, our research, well, at the minimum, we would contribute to literature, but we also want to benefit our Missouri public health workers through a public health workshop, like through capacity building, and eventually somewhat co-develop policy outputs like a white paper on generative AI use in public health in the state of Missouri. So those are things. And we do have like a couple of research grants that we want the Missouri Public Health Association special section for public health nursing to be part of. So there are two of them, which I'll briefly discuss. So we did submit a grant for WashU last year, and we were unfunded, but we were encouraged to resubmit. So we will resubmit this September. It's a 1-year project wherein we plan to actually implement like capacity building, like workshop training, but the focus will be on vaccine promotion materials, like how you can like tailor vaccine promotion materials, like improve the language using AI, how to do that responsibly. And the focus is more on Central Missouri. Because of the limited funding, we decided to just focus first on Central Missouri public health workers. So this can be RNs, this can be other health professionals. So we collectively use the term public health workers. And we would like to request the Missouri Public Health Association special section for public health nursing to be our partner institution, because it is not feasible for the Missouri Immunization Coalition to continue to be a community partner because of funding cuts. So they're unsure whether they'll be able to continue beyond like this year. So that is something that like I would like to request from MPHA. And the proposal is ready to review. So this is like really minor revision for us. The problem is that we need to replace the Missouri Immunization Coalition, and perhaps we can partner with the Missouri Public Health Association. The next would be a much larger grant. So the NCSBN grant program, National Council for State Boards of Nursing, they're interested with the implications of AI in nursing. And I'd like to put in a flavor for public health. This is like the extent, like just a much larger scope for the Washington University grant. So I'll just write a couple of details, but basically the changes is that first, much higher funding maximum, like 300K, and we'll not just focus on Central Missouri, but the whole state. the whole state. And but since this is NCSBN grant, nursing, Missouri Public Health Nurses, which may involve nurses in local public health agencies and also school nurses. And this is not just for vaccines, but for public health work, what like any kind of public health work. So it's much broader in scope. And I'm also like, aside from the Missouri Public Health Association, I'm having discussion with some representatives of the Department of Health and Senior Services and also the Missouri Public Health Institute and the Missouri Association for School Nurses. I would like to have them on board for the NCSBN grant program. But in future grants, I also want to apply for federal funding for the Agency for Healthcare Research Quality. It has an expiration of July 2029, so I'm looking forward the long term on what this collaboration would mean. And they're looking for research to improve healthcare delivery and practice improvement. And the word AI keeps popping out in that application, in that grant application. And we want to scale up this Gen AI workshop, like involve more people. Maybe not only in the state of Missouri, but other neighboring states. And to also involve community stakeholders aside from public health workers. So the limitation with these two projects is that we might not involve yet the general public, our constituents. It'll just focus on like public health workers, hopefully with federal funding, like maybe in $1 million, we can involve community stakeholders, like our constituents as part of the research. So the role that the Missouri Public Health Association section for public health nurses would have is that like give us guidance on study design, data collection, and analysis. So we want you to be on board on the research process. Next is, given your network on different sections of public health, you have networks with local public health agents, with school nurses, and other public health settings. We would like to tap into your network to send data collection and workshop invitations. Third is the Missouri Public Health Association is one of the organizers for the Joint Public Health Conference. And most funding agencies would like to see that there's a mechanism for us to present our research. And aside from national level, international level conferences, I actually really want to attend like state level conferences, because that's where you can actually make an impact at the state level. Next is co-authorship in research papers. So that is something that we would like to work with you. And finally, providing us with a letter of support. I can we can give you the templates, so we can give you guidance on how to do that. But essentially, that is something that we would request if you are on board to be part of the research project. That is the end of my talk. I hope that what I shared gave you some insights on what are the implications of artificial intelligence in public health. And I'm looking forward for any questions or clarifications about the potential role of the Missouri Public Health Association special section for public health nursing. So thank you very much.
Thank you, Robert. That was amazing. I love that so much. I'm going to open it up for questions. Does anyone have any questions? And I'm just going to let you all, instead of me calling on you, I'm just going to let you kind of navigate the bar and ask any questions.
I heard you mention the Missouri Association of School Nurses. Tell me a little bit more about how you feel school nurses can be involved in that.
Yeah. First is that when I'm conducting my research, I always want to interview people that might be hesitant to use these technologies. So most people think that this might not have an implication to school nursing, but our students are now using this to search for health information, their population, their setting involves dealing with cases that involve like adolescents, like basically the pediatric population, and they're the early adopters of technologies. And if the students are using it, getting health information, then by default, they should be aware of it, of how these technologies work. To some extent, it could also help their work. But I do recognize that some school nurses might not be actively using it, and that is okay. And we want to know why and what are some of the reasons. And are there any opportunities that this technology could help them in their work? So that's why I was advised that most public health research is really focused on like local public health agencies, but we shouldn't really forget on our school nurses colleagues. So that's why part of the project for both grants is that we want to work with, like, for instance, public health workers. It's an umbrella term which includes school nurses. Then Missouri public health nurses, that also includes, our definition of that includes the school nurses. So it's always the case that like sometimes school nurses is thought of as not part of public health, but I mean they're essentially part of public and community health. So we shouldn't really forget them.
Absolutely. Absolutely. Our school nurses are part of our public health system, and we love them so much. So we thank you for including them in your work, Robert. Was there someone else that had a question? You could come off mute. I see that Sandy also dropped the call for presentations from the public health conference in the chat. So if anyone wants to look at that, you're welcome to that. And there it is. So thank you for that, Sandy. So appreciate that. All right. Well, I don't hear anyone else popping in to ask any questions, Robert. So thank you so much for that. I'll have to admit, I've been a slow uptaker on the AI stuff. Now, I love my Grammarly, and I suppose that's a version, like that's like an early version, right? So I love double checking my stuff with Grammarly and making sure that my writing is concise or proper. But then I'm just now starting to navigate more of the AI information, and more so of like helping me when I'm stuck with my writing. Like, can you help me to clarify what I'm trying to say here? Can you help me make this a little bit more persuasive or something like that? And so I love those pieces. And I love the fact that you also mentioned ethics in that, because when I was working on a 500 words, that's not much, right? Until you're writing it. And then you're like, okay, squishing it down and spreading it out, right? And so I did drop my writing into ChatGPT, and I asked it to help me make it a little bit more persuasive. And what was interesting was all of a sudden a statistic showed up in my writing that I did not put in there. So I was like, wait a minute, I don't know where that came from. So it was helping me make it more persuasive by adding some statistics in there, but that statistic was not a true statistic. And I had to know that that wasn't a true fact of information. So I think that's definitely where I start to see okay, where do the ethics come in? You've got to know, you've got to be the expert. So then when you ask ChatGPT or whatever to help you, you can define, yes, this is correct, no, this isn't, or take me to the research article that supports this, right? So I'm learning my way around that, and I would love to be able to come to a workshop that really talks about bringing that in. And so I wish you well on your achieving some funding for that. And I know the central area of Missouri would be excited to see some more resources come in. So,
Yeah.
all right. And
So
Kelly says she loves Chat GPT. So see, that's encouraging.
I also like the idea of like, establishing some guidelines and some parameters and things. I think that's
yeah,
one of the things that you're focused on as well. And working with the state health department kind of on something overarching for the state, I think is really a great idea and exciting. And like you said, it's here to stay. We need to learn how to use it appropriately, and think about all the things that you mentioned in terms of, like you said, Louise, ethics and usability and how our constituents and citizens would feel about that. Like I think it's very timely, and we need to be not behind the eight ball. We need to kind of be ahead of it and get on top of it. So
yeah. So I think a question that I'd like to ask for everyone is, who should I coordinate from here on about any possible requests, like for instance letter of support, any possible updates. Is there anyone that I could use as a point person for my request?
Yeah. Trina, I was just thinking you've got a good, you've been a great contact so far. Trina's kind of helped us. This would definitely be, depending on what it is that you're needing, we would have to have a vote on it through our
Yes.
executive committee. If it was just through SPH or the Section for Public Health Nurses, or if it's at the larger organizational level, it'll have to go to MPHA. So we can definitely, Trina and I can definitely communicate with you.
You can just reach out to me, Robert, and what we'll probably do is set an executive committee meeting to discuss.
Just let me know also if there are any materials that you request from me, like my PowerPoint slides or any kind of material that would help you in that decision making. So, but in general, thank you so much for giving me the platform to share my ideas. And
thank you.
Thank you.
Appreciate that so much. All right. Well, I think we're just going to keep on with our agenda. That was so great. Loved hearing that. And I think that was the last that we had on our oh, someone has put in, Amber Lee said that she uses Chat GPT as well. And then she asked John Robert if you could put in your contact information in the chat. So if someone could reach out to you.
Yep.
We appreciate that. Thank you. All right. I love the fact that public health nursing is going to be is more on the upfront side of learning about something and still waiting, instead of waiting till it's like old news and then we're like, oh, well, we want to learn about that. So anyway, all right. So we're going to jump into our old business. And Trina, you're kind of our lead here as far as like jumping up with the website and talking a little bit about, so just for any of you that are joining us that are not familiar with some of the old business that we have, we've just had a I don't want to say cluster because that kind of sounds bad, but we've had a group of projects that all just Kayla was able to just kind of get the ball rolling on a variety of things, but we were so great that we had so gracious that we had public health nurses that stepped up to kind of be sub project leaders in that. And so Trina is our first one out the gate. And Trina, I'm just going to let you talk a little bit about, you want to kind of go.
That's fine. Sandy, can you make it so I can share my screen, please?
I think I'd just like to excuse myself if it's okay. I need to pick up my kid in school. Thank you so much for giving me time to present my work, and I'll just communicate with Trina about the future. Thank you so much.
Thanks, Robert.
Thank you. Bye.
Okay, can you guys see my screen? This is so weird. I hate that on Zoom. I don't know what you guys are seeing. So this is our website. It should say Missouri Community of Public Health Nursing Practice at the top.
Yes.
So this was in partnership, again, with the Ozarks Public Health Institute, Missouri State University. We worked with closely with their IT team. Corey was the person that was our contact, and he was great. So just kind of wanted to walk you through if you haven't seen this already. I realized I was out of the country for a week and a half, and before that, I was going to put something in the Friday Facts, but then the Friday Facts, they quit doing it for a couple weeks. Anyway, I haven't officially put anything out there about the website, but that will be coming soon. I just added it to my to-do list again. Anyway, so this is the website, and it is our Missouri Community of Public Health Nursing Practice website officially. And so the landing page talks about the community of practice, kind of how it was created, and there's a place right on the front page for people to sign up for a mailing list, which I will talk about when I talk about the marketing plan a little bit more. And so the IT team and the marketing team have also worked together on the website for some of the things on the website. And so this is just the front page. There's a few resources that are available for people to download. But I also want to show you on the front page too, there's a little box where the community of practice is there. There's a page for public health nursing resources, and then there's a page about our section, which is, it's kind of confusing because the section has been doing a lot of the community of practice work, but they are separate entities essentially. So let's see, if I click on community of practice, it takes you to a different page. And it talks about our goals for the projects, the community of practice project. There's a PowerPoint presentation that talks about our community of practice project, and then also some of the benefits. And then again, there's a place for people to sign up for the mailing list. And then there's also a community of practice email address that goes to, I think that goes to Sandy, but then Sandy shares it out with the executive committee. So it's an mpha.org email address there at the bottom. If we go to the resources page, there's a lovely picture of my team. It's just a very old picture, but I'm not in the picture, but this was my team a million years ago. And so here, and I think Pam is going to talk more about the manual and the brochure and the things like that. But all of these things, I believe, have been updated. The brochure's been updated, the manual's updated. There's a resource list and those sorts of things on that one. I'll let you guys, I won't go into deep on that, but and then we go to the section for public health nursing, and it talks about what we do as the section, our vision, mission, and values. There's a link to the bylaws, and then we have our own email address at the bottom there that also goes to MPHA, Missouri Public Health Association.org. So there's a separate one for the community practice and a separate one for the section, and then the mailing list. So any quick questions about the website?
Trina, excuse me, this is Martha.
Yeah.
Will there be capacity within the website platform for a listserv, where there's interactive dialogue?
I don't think that's in the plans. I think that's what the mailing list is for, so we can send out information, but there's not a listserv per se. I don't think that was in the budget.
Okay, I know we had talked about the possibility, but then I wasn't sure where we ended up on that.
Yeah,
so
and I didn't know if there was going to be something like with MPHA and MoAlpha combining if there was going to be some kind of a listserv type thing with that under that organizational umbrella, but I don't believe that was baked into specifically for the website.
Yeah, because MoAlpha had a public health nursing, they didn't call it a listserv, but a communication board, if you will.
Right.
But to my understanding, it was never really utilized much. We
Martha,
do still.
Let me just interrupt for a minute. It is on the new revised website that MPHA has. There is a listserv for administrators and billers currently.
Okay, which there used to be at MoAlpha, so that's probably part of that transition. So maybe that's something we just need to explore further for public health nursing. I'll go ahead and drop the email for the public health nursing listserv that has been in place for many years. I know that Sarah and her team still promote nurses signing up for that when they do MCH orientations with LPHAs. I still send things out periodically on that, but I know that the contact list for that is not necessarily current, and there's no way for me to know which email addresses are still active and which are not, as well as it's not all inclusive where it's going to everybody. But I'll go ahead and put the email in there and encourage people to use it because it is what we currently have. But then maybe down the road, there'll be an alternative option. Thanks.
Yeah, maybe I don't know if that's something Louise could bring up with MPHA at the next board meeting and see what the options are for having listservs for other specific groups.
I will add that to my list. It's a great question.
Any other questions about the website?
All right.
I'm gonna share something else. So I just got an update yesterday from the marketing team about our marketing for the community of practice. So she sent it to me as a PowerPoint presentation. So some of it I don't understand, but I'm going to go through the slides quickly with you guys. So it looks like, and I don't know what top of funnel tactic means, but this is our Google searches. And apparently our click-through rate is within the acceptable range or is above benchmark range, which is good. And then the average, I forget what CPC stands for. I'm not really sure I understand that. But according to their analytics, Dallas County seems to be the most engaged, and then females ages 25 to 34 are also high engagement. And you can see there at the bottom one of the pictures one of the advertisements that shows up on Google. You can see on the little map, it looks like we've had some engagement from outside Missouri. And I think later she mentions there's a way for them to tweak that so that they can keep it within Missouri. That's Google display. And then here's a paid search, which again, I'm not sure exactly what that means. If anybody knows these things, pipe up and fill us in. But I think when you see SC on these slides, that's strategic communications. That's the group at Missouri State University that we're working with. They're going to work on, like she said, narrowing location settings, working on keywords, and then they're trying to improve the click-through rate for these particular types of advertisements. So this is I think a little more understandable, where we had 569 users visited our website from the ads. 87 users clicked an internal web link. 17 users submitted a form from an ad, and then 7 people downloaded content from our website. I don't understand scroll percent So this is just me getting this from her. I will probably set up a time to talk with her so I can understand this a little bit better, but I just got this yesterday afternoon. Um, we've had over 150 form submissions since the campaign launched, which I think is amazing. Although she did reach out to me because some of the submissions looked like they were bots or spam submissions. She had asked me if we were playing around with the forms, and I told her I didn't really think so. I signed up myself for the email notifications and stuff, but I didn't think anybody was really kind of playing around with it. But that, and it's on this slide too. Have we been sending communications? We have not been sending any communications yet with the form submissions. And so I was going to talk to her about the managing email lists and communications piece specifically when I meet with her next time. As far as next steps, they're going to pause our ads at the end of May and they'll start up again July 1st. They're going to build out search words that will focus on that demographic that we talked about, 25 to 34-year-olds that are high engagement, and then narrow those location settings to just Missouri, like I mentioned earlier. They are recommending we shift some of our budget to something else. Again, I don't really understand the meaning behind this, but they're the experts. So if that's what they recommend to increase engagement, then I guess I'm okay with that. The strategic communication will optimize and monitor weekly, and then they'll give us the first go round wrap up report mid-June. And so if that's something, if we want them to meet with the executive committee, or if you want them to present at our next meeting, we could probably do that. We'll just need to talk about how we want to do that going forward. And then if we have any like meetings or trainings or news resources or anything like that, they really want us to let them know so that they can increase that information and pushing out that information. So if there's anything that we want to add to that, please let me know, and we'll push that back out to the strategic communications folks at Missouri State. Overall, it seems like it's going fairly well. I don't know that I really had any expectations, so I think that it is all good. Any questions about that or anything you guys want me to take back to them, to Kayla at the Missouri State, specifically about the marketing campaign?
Yeah, I'd love to hear when the results all come together. I'd love to hear the little bit more detail and understand some of that. That's my first kind of insight into some of these practices.
Yeah.
So that would be good.
Okay.
I also wonder, kind of what you were saying was, I wonder if we could do something that says something about joining the section for public health nurses at the MPHA conference. Is there something that we could put out kind of about that, like kind of promoting it when the time is right?
I think so, yeah. Okay. We can talk with her about that if we put a meeting together in June for the review of the first round and kind of talk about where we are and where we're going. We could definitely talk about that.
Sounds great. Sounds great. Thanks, Trina, for sharing all of that.
Yeah.
So great. So exciting. All right. Well, Pam, would you like to talk a little bit about the preceptor manual, the brochure, and the resource list that's on the website?
Yes. They're all posted there. And what I noticed yesterday is they moved some of this. If you go to Ozarks Public Health Institute main page on MSU's website, it's on the front page there. And there's also a list on the side where it's got public health resources, and you can kind of get where Trina was at. But they're all there. The preceptor manual has the last page has a spot for feedback. Was the manual helpful? How did you use it? What was your role? Were you a student? Were you a nurse in training? Were you the preceptor? And so that is there. And if you go through the documents, please provide feedback if you see something that's misspelled or something that should be added, because I think we'll continue to update the manuals and the resource list. And the brochure, it's all there. Love the feedback. And then we've got, well, Diane will talk about the student. Martha identified some case studies that would be good to include. And so we do have a student working on those, and we can include those whenever, just extra or on the side. So, or in the future, you guys need to decide, executive committee would need to decide when those are done, to how you want those placed. So anyway.
Pam, something that I thought of recently when I was kind of going through that website and looking at the manual, and this may have been a question that was already brought up and hashed out long ago, and I apologize, but did we think about or discuss possibly breaking we've got the whole unit of the manual, the preceptor manual, but did we consider like having the narrative piece and then having like subsections of each or separate documents for each of the case studies, so that if we did need to update one particular case study, we could do that? Or if someone wanted to send someone to do a case study, they could find it just from like a drop-down list or a side column or something.
There is the table of content that would get you directly to each case study. And
right.
And that's why I put the previous preceptor manual had the case studies all in consecutive order, and then the answers to the questions separate. That's why I kept them together, because it seemed like they could keep them together. But I wasn't part of any conversations about pulling them out to the case studies separate out. So
I was just thinking about it. We'll see how time unfolds and if that's something we need to do. And then also the other question I had was when we worked on all of these manuals, the resource and the resource list, etc., all of those are now, saved on the website as a PDF. Do we still have access to the Word document so that we can actually go in and make edits without having to start from scratch again?
When I sent those out to you and Martha, and I think Kayla and the team, Trina, I sent PDF and Word.
Okay, perfect.
Yeah.
Well, I have baby brain right now, so I've forgotten about that. But
that's all right. But yeah, I did. And if you need it again, just let me know.
Okay.
But I did send that out to more than one person, because I've, people move around. So.
Well, and people lose things on computers or whatever. So, all right. Well, thank you, Pam, for all your work on that. And I love the brochure, just all of it together. It's all come together so nicely. All right, Diane, I saw you join us a little bit ago and didn't know if you could give us a little update on the student that has been working with you. She may have had to step back out. Let me see.
Here I am.
Oh,
hi.
yay.
Sorry.
Hi.
So Jan Lee Alice has developed all of those case studies, and I think really did a remarkable job. But her time will end with us at the time of her graduation. So that is May 9th for her. I just think she did an extraordinary job. She doesn't really have a public health background, and she's only been in the country for a few years, but she's learned how to research. And so she did a remarkable job with that. So she is a nurse educator, and I'll just plug for her. She's looking for a job. So she has enjoyed her time at Public Health and at Fordland, and she wanted me to thank you all for the opportunity that she had, and she learned a lot. And so I hope you take a good look at the case studies. They are truly very good, and I'm going to share them with our faculty that they might want to incorporate them in some of their courses as well. So
Great idea. Great
yeah,
idea.
yeah.
Well, thank you, Diane. Appreciate you sharing that with us and making that connection. That was such a great idea. So love that so much. All right. Well, Trina has already shared our marketing campaign and the work that's going on there. So I am just, I guess it's now time as we start to wrap up our conversation to just give any updates. And I'm just going to go through the list and do shout. And if you have something you want to share a couple of pieces on, then you're welcome to do so. I'll just start real quick and just say we are actively in the accreditation mode and trying to get our stuff all finished up by early fall. And we are, we've got all of our big policy projects that are the big dominoes all coming together at the same time. So pretty exciting. And the other thing that I wanted to share is we have it's called Protect and Prevent Project. We received $10,000 from the Missouri Suicide Coalition, and they helped fund us to create, we did it through like SurveyMonkey. It's an educational platform where we loaded in pre-test questions and then 3 videos, one on medication safety, one on gun safety, and one on like suicide awareness and communication. We put those 3 videos on there, and then the post questions, so pre and post. And if they go in and do this self-study module, then they can receive a home safety kit that Missouri Safety Coalition helped to fund. So a medication lockbox, the gun locks, 988 information, and some other things that are in there. And our goal was 200, and we've already, in our first 6 weeks, we've already exceeded our halfway. We're already halfway done. So that's like a woohoo. We're super excited about that. And then they also partnered with us to do a prize drawing for anyone who participates in our educational platform and then chooses to enter their name into a drawing. They can be drawn. We'll have one winner for a home gun safe. So it's really been a great partnership. It helps us with our unintentional injuries through suicide prevention and just all of that together. So was really excited about that. We've just got so many things that are weaving together. It's exciting. So I'm super happy about that. So I'm going to stop there. And Diane, you're still on my big screen. So I'm going to let you give an update if you have one.
I really don't have much to say. Just working forward to graduation on May the 9th. And, you know, my public health experience right now is kind of limited. So I don't have much that would interest the group, but it's good to be here.
Thank you for being here. We really appreciate you. All right, Trina, you're next on my list. Do you have anything to update?
I mean, not really. We're just like everybody else. We're dealing with budget cuts and hiring freezes and, you know, that kind of thing. We are undertaking strategic planning for the department tomorrow, so that should be interesting. Kind of hard to plan when you don't know when you're just reacting to things, but otherwise, no.
Okay.
Thanks.
Thank you. Pam, you're next. Do you have anything else to share?
I don't at this time. Thank you, though.
Okay. That's perfectly fine. Martha, I know you've shared a lot. I don't know if you've thought of anything else you wanted to share.
Not that comes to mind right now. Thank
Okay,
you.
that's fine. Sarah, you're next.
I don't have a lot to share. So we have a team of 4 district nurse consultants, and this is the time of year we go out and do site visits with our local public health department. So if we haven't seen you, local public health departments yet, we probably will soon. And it just gives us a great opportunity to go and see local public health in action and your communities. And we're always so proud of the things you're doing. So thank you. That's all we have.
Yeah.
That's all we have.
I always think I get such great ideas. Like they're coming to us to hear, things, but then at the same time, I ask so many questions, as you can only imagine. I ask so many questions. I'm like, oh, well, that's a great idea too. So I love hearing all of those things from the different counties that they serve. All right, Tara, you're up next. Do you have anything you want to share?
We're here and we're just doing everything as it comes, rolling with the punches and the cutbacks, and we're doing what we can do. I don't really have anything update.
All right, well, we're in it together, right?
Oh,
We're
yes.
all doing that. So
yeah,
we're doing it together. Okay, Amberly, looks like you might be next.
So in Carl Junction schools, we're working with Jasper County Health Department, and they're working with all of our area schools. Actually, they've been holding meetings with us, with the school nurses and the admin, and we're trying to have a proactive approach for measles. So we've developed a short list of all of our exempt MMR families with all of their contact info ready to go. I personally sent out a letter this week and an email communication as well, just to let those families know what to expect and what the situation currently is, and try to encourage that immunization if possible. I don't know if it will help, but that's what we're working on. And then my next step is so I've got my short list. We communicated to exempt families, and my next step is to communicate with my staff so that they can start to know their immunization status and whether or not they might need to get a second MMR if they're, in that group that only received one. So we're trying to be proactive about it, and knock on wood, I hope it helps, but we'll see how that unfolds. Yeah. So that's what's going on in Southwest Missouri.
Thanks for the ideas, Amberly. We're going to start meeting with our school nurses and admins here pretty soon, and I like your idea of what you're doing.
What I sent to my families, if you would like to share that with other school nurses to use,
that'd be great.
Platform.
Yeah. Agreed.
I'll put my email in the contact so you can email me about that.
Kelly put up a hand first and then a heart. So I think she is all about what you're saying too. Did you have a question you wanted to ask Kelly, or you were just agreeing with her?
No, great work. I love when we can get the local health departments to, collaborate with our school nurses. That's our ultimate goal for, the future, is get all the health departments talking to the school nurses, because it is very helpful for us to, be working with them and know our contacts. And so you can, if something does happen like that event, that you know where to go, you know how to get things done.
And that's been important. They've shared with us their cell phone numbers. So if we hear of a case on an evening or a weekend, we can start to move that wheel quickly, and they'll even come in to do evening or weekend immunizations for us if we need to. So it's been good. And, if anything came out of COVID, it was that it strengthened our relationship with our local public health department.
Well, that's a win. I'll take that as a huge win. And also, I just think that upfront education to those families is so important, so they don't feel like later, like, oh, you're just trying to target me. No, I'm not trying to target you. What I'm trying to do is inform you ahead so that you know how this is going to unfold, so I think that awareness and communication is huge. So great job on that. All right, I've totally lost where I was at in my on my list. I feel like Macy, I don't think I've asked you if you had anything to share.
I think Sarah covered it all for us, but if you're one of my counties or if you're not and you need anything, just let us know. We're always here to help.
Okay, thank you. And I think it was Alicia, right? Alicia Hicks, is that right? A Hicks, I can't remember. Okay. And then Christine. Did you have anything you wanted to share with the group?
Yeah, everybody's getting shy.
I know, right? It always happens. It's perfectly fine. Well, then I'll just do a shout out to the group. If I have overlooked someone in the list, my apologies. It was not done intentional. Just trying to navigate through this laptop here. Does anyone else have anything they want to share?
I'll
Because
share something. We are putting on the health orientation, office orientation for new school nurses and health staff. And then we're doing a new lead meeting this year and then a lead meeting. So if there's any topics that you guys think that we need to be covering, I would like to do like a touch base with public health and how school nurses can connect with their public health departments to have that connection. So we'll do probably a presentation on that also. But if there's any other topics that you guys feel like we need to be disseminating out to like the lead nurses, just let me know. I'll put my email in the chat too.
perfect. Perfect, perfect. My goodness, what a great meeting we've had today. I'm trying to take it all in.
I know, it's a lot to process.
So good today. All right. Well, oh, there's Kelly's email in the chat.
Louise, before we
Yes.
go, I was just saying, since we have Kelly and Amberly on here, how could we, or are there some things that they could share with their school nurses more widely to encourage them to attend these meetings? I'm not sure what we have or where it is. Like a flyer or something. Do we have something like that?
We have a new brochure that Pam was able to pull together that just talks about public health nursing as the whole. So yeah, definitely from the website we could do that.
We have something that we've put in the Friday Facts before that's a flyer about joining MPHA and this section for public health nursing. I'll have to dig it up.
Okay.
And then I guess as they join, they would get an invite for the meeting. I was just trying to think, we don't have like a list of meetings set for the rest of the year, do we? Is that how that would work?
We've got a tentative list, but of course I'm not at my desk, so I can't pull that up to see. But typically, like June would be our next
July
virtual-
31st is our next meeting.
Okay.
Thursday, July 31st, and then our fall meeting is usually at the Joint Public Health Conference.
Okay.
Thank you, Trina.
Thank you.
All right. And this meeting was originally, planned for last Thursday, but there was like 2 or 3 conferences going on at the same time. And so we felt like we needed to push that back just a bit. So anyway, all right. Well, folks, I had thought that I might be able to give you a few minutes back, and look at that, 5 minutes, 11:55. So that's always exciting. Well, thank you all so much for joining today. If you have anything that comes up, any questions, or feel free to email me or Sandy where you received your agenda from, and she can forward that out to us. But so appreciate everyone. I hope you have a wonderful day. I hope the storms that move through Missouri continue to stay minor and just move through and bring us some showers for Mayflowers. So anyway, all right. Have a great day. It was great seeing everybody. Bye-bye.
Bye.